and go.
Hello, everyone, and welcome. My name is Avery Broman, and I'm the Executive Director of the Victoria Hospitals Foundation. We're thrilled to have you join us here safely and virtually today. And we're honored to have guests in various locations across our beautiful province here with us as well. On behalf of everyone in these locations, I'm grateful to be joined in celebration together on the territory of the Lekwungen people from the Songhees and Esquimalt nations, and also the Musqueam, Squamish, and Tsleil-Waututh nations who have ties to the land we join you from today. We're thankful for the opportunity to gather on these ancestral lands. This morning, we're celebrating philanthropy and what happens when our community champions healthcare. We're joined by some special guests, local media, and dignitaries, including Mike Halligan, the Executive Director of the Dennis and Phyllis Washington Foundation, joining us from Montana. Hi, Mike. And
hi, everybody. Welcome. Thank you.
Thanks, Mike. And Frank Butzelar, Seaspan ULC's CEO. I'm also joined by my incredible colleagues, our board of directors at the foundation, and the leadership peers within Island Health of Mine, including Kathy McNeil, President and CEO of Island Health. There are many other friends and supporters of VHF, including patients and care teams here with us today as well. As the Victoria Hospital Foundation's Executive Director, I have the profound role of leading transformational giving for our local hospitals. As our largest charitable partner of Island Health, we collaborate with them to enable donations to every area of care in our hospitals. I'm proud to witness everyday miracles through giving that deeply impact our hospital teams and the patients they serve across Vancouver Island. When COVID-19 impacted our community, we asked our care teams what the single most critical need in our local hospitals was, and their answer was clear: expanding critical care. In the last 10 years, Royal Jubilee Hospital has seen an 83% increase in admissions to our ICU. And with a growing and aging population here, hospitalizations are expected to rise over the next several years. In response to this, our foundation collaborated with Island Health and launched It's Critical, a $7 million fundraising campaign to expand critical care capacity at Royal Jubilee Hospital by 73%. This would operationalize 8 new beds. This campaign will build Vancouver Island's first permanent high acuity unit. You may know this as an HAU. This would be our largest campaign in over a decade, and we need community support now more than ever. Over the past 8 months, 2,300 donors in our community have stepped up and helped us raise $1.9 million for a permanent, purpose-built HAU. Even with all of this amazing work in progress, it was clear we needed a community leader and champion to help advance our campaign forward. And we found that leader in Seaspan Victoria Shipyards and the Dennis and Phyllis Washington Foundation. With their support, we can truly transform critical care here on Vancouver Island. It is my honor to introduce Kyle Washington, Executive Chairman, Seaspan, and Director of the Dennis and Phyllis Washington Foundation, to tell you more about their generous transformational gift. Welcome. Such a privilege to have you here with us today.
Good morning. It's my pleasure to be here today representing the many thousands of Seaspan employees in British Columbia. I'm also representing the Dennis and Phyllis Washington Foundation that my mom and dad started 32 years ago. Over that time, the Dennis and Phyllis Washington Foundation has done amazing things with youth and education, including thousands of student scholarships. I've lived in British Columbia for over 25 years. I'm proud to call this place my home, raise my kids here. And like my parents, I've got a long-standing commitment to giving back to the community. My parents share a deep commitment to philanthropy. They believe it's the greatest benefit to society is made by uplifting individuals and improving the quality of their life. They're both passionate about supporting projects that not only bring people together, but will last for generations. Earlier this year, when COVID-19 emerged, I think we all recognized the importance of having a high-quality healthcare in our communities in order to meet the challenges created by the pandemic. When I learned about the Victoria Hospital Foundation, its critical campaign, and the gap in care that it would fill, I saw how clearly it aligned with the mission and the goals of the Dennis and Phyllis Washington Foundation. Seaspan is a company that has a long history of caring for the communities where we operate and where our employees live. I knew what a difference this gift could make. Supporting a healthy community, one that has advanced healthcare that we can all rely on. We were inspired that the Victoria Hospital Foundation created such a critical response to the pandemic our community is facing now and for generations to come. We spent many months working on how best we could not only support our hospitals, but also inspire a community to do the same. I'm pleased to announce today that Seaspan's Victoria Shipyards and the Dennis and Phyllis Washington Foundation have made a gift of $2.65 million to It's Critical to help expand critical care capacity at Royal Jubilee Hospital and build Vancouver Island's first permanent high acuity unit. This gift recognizes the care teams who serve Vancouver Island communities so selflessly each year and every day and ensure we stay healthy and well. It's now my pleasure to introduce to you Joe O'Rourke, our leader at Seaspan Victoria Shipyards. Thank you.
Thank you, Kyle. Your leadership propelled this gift forward, and we here at Seaspan Victoria Shipyards are grateful for the investment you have made to our vibrant community. I have been proud to call Victoria home for 6 years, and during that time, I've been so impressed with the close connection Seaspan has with its communities. And through the Dennis and Phyllis Washington Foundation, I'm grateful to have the opportunity to make a lasting difference here. At Seaspan Shipyards, I work with a dedicated, talented team of over 1,000 employees each day. Working within the public facility, Esquimalt Graving Dock, our team refits, repairs, and converts vessels. We do this for governmental customers, like our work on the frigates for the Canadian and New Zealand Navies, on submarines for the Canadian Navy, on ships for the Canadian Coast Guard. We also work on commercial vessels such as ferries, cargo ships, and in non-COVID times, cruise ships. We work on unique projects such as the LNG dual fuel upgrades for towed maritime vessels, the first dual fuel conversion in North America ever executed. We specialize in large and complex projects, but serve the overall market from barges to full-size vessels. And we never forget our primary mission of ensuring the Canadian Navy sails with fine, well-maintained vessels to protect and defend our country. At Victoria Shipyards, we have built a reputation of on-time, high-quality delivery of projects, ones that are often complex in nature. We have this reputation today because of the skill set and dedication of our team. From our welders, steel fabricators, joiners, mechanics, carpenters, electricians, other trade men and women, and all the support departments that help them. Each function that supports this work, whether it's procurement of materials to the security of the vessel, all support our commitment to deliver the ship on time and well executed. It is my great pleasure in extending Victoria Shipyard's commitment and philosophy of engagement to the local community that we live in. This contribution is a direct reflection of what we are and what we strive to be: engaged, supportive, and committed. We work together as an integrated team. And while we are a team, we are also a family, and just a very large one. And this gift extends our family into the overall health of the community we live in. Our family understands how important our community is, and we are very aware of our community thrives when it is healthy. We even are more aware of how important good health and good health care is to us in this year with COVID-19. As a company that cares not only about its employees, but about their families and the community where they live, it was important enough to us to help transform and advance healthcare here in Esquimalt and Greater Victoria. With our $2.65 million gift, we have advanced the campaign to reach $4.6 million, with $2.4 million left to go. I am very proud of Seaspan for stepping up when the community needed us, and now I hope others will do the same. During this significant moment in our lives, when our entire community is focused on health, we have a unique opportunity. Let's make a permanent high acuity unit a reality on Vancouver Island. On behalf of all my colleagues, the Victoria Shipyard team, and the foundation that is making this happen, I want to thank you for joining me at the shipyards here today. We're so proud to champion this important cause. Let's see that do this together. Thank you.
Kyle, Frank, Joe, and your teams, our deepest thanks to you. Any of us, our loved ones, could need critical care at any given time in our hospitals, and we want them home happy and safe and healthy. This gift is leaving a profound legacy in our hospitals for generations to come, and I can't thank you enough. To the Island Health community, you are vital. I'd now like to invite Leah Hollins, the chair for the board of Island Health, to share what this gift means for our community and our hospitals. Leah.
Thank you, Avery. On behalf of Island Health, I offer my sincere thanks to the Victoria Seaspan Shipyards and the Dennis and Phyllis Washington Foundation for this generous gift, supporting the delivery of care, as many have said before, for generations to come. At Island Health, our vision is to provide excellent health and care for everyone, everywhere, every time. Our teams are committed to creating healthier, stronger communities and a better quality of life for those we serve. Today's donation will help us propel this vision forward. As our communities continue to grow, so do our health and care needs. For us to meet these needs, our healthcare teams need to have leading edge resources, equipment, and the space to do their work, which is why philanthropy in our hospitals is so vital. When the community comes together to support the Victoria Hospitals Foundation, you provide our care teams with the resources they need. Local community leaders like Seaspan help us expand, innovate, and serve the community to deliver the exceptional care we are known for. As Avery mentioned, expanded critical care in our hospitals has been a long-standing priority for Island Health. Since March, our hospitals and care teams have faced tremendous challenges in response to COVID-19. The priority for critical care became more urgent, and we're grateful that Victoria Hospitals Foundation responded by launching the It's Critical campaign. Today's incredible gift brings us much closer to making a permanent high acuity unit a reality for the more than 850,000 Island Health residents. The high acuity unit at the Royal Jubilee will be a first for Island Health. It will support patients who are not quite ill enough for the ICU, but too sick for acute care, and they must have the specialized care they need, which they will get in this high acuity unit. Thank you to everyone here today for coming together to make this possible. It will make an incredible difference for so many patients. And it's now my great pleasure to introduce Dr. Omar Ahmad, Department Head, Emergency and Critical Care Medicine for Island Health, to share more about what a high acuity unit means for our care teams and patients. Dr. Ahmad.
Good morning. Thank you, Leah. And thank you so much to Seaspan and the Dennis and Phyllis Washington Foundation for your absolutely incredible support of the Victoria Hospitals Foundation's It's Critical campaign. Your generous gift will make a tremendous difference for our care teams and our patients. As the department head for emergency and critical care medicine, I have the honor and privilege of leading our medical teams in our emergency departments, intensive care units, and now the new high acuity units across Island Health. I also provide care here locally as a physician working in the Victoria ICUs and emergency departments. Let me tell you a little bit more about the permanent high acuity units and the type of patients it will help. The HAU is a dedicated unit that provides critical care to patients that are indeed very, very sick, but not quite sick enough to need the level of care required in the ICU. However, they still need close monitoring and specialized care. We certainly need expanded critical care on the island to support our ever-growing and aging population. To put it simply, we need more beds to keep up with the growing critical care demand. The new HAU is nearly doubling the critical care capacity at the Royal Jubilee Hospital. It enables our hospitals and teams to be more nimble to respond to critical care admission surges, as we may see during periods like the influenza season, of course, in response to COVID, and any potential for mass casualty events. A high acuity unit relieves stress on our ICUs, our inpatient units, and the emergency departments. HAUs serve patients recovering from surgery, those with cancer, those in severe respiratory distress, or patients being treated for other very serious medical conditions. At the Royal Jubilee Hospital, approximately 40% of our patients come from outside the Greater Victoria area, which means that your gift of helping us build these HAUs has an expanse well beyond just Victoria and serves the patients of our entire island population. We recently had the pleasure of meeting Gordon, who I'm privileged to say has allowed us to share his story with you and has joined us today. Gordon was a patient at the Royal Jubilee Hospital and is the type of patient who would certainly benefit from the HAU. In early March, Gordon went away to celebrate his 75th birthday on a ski trip. Unfortunately, within a couple of weeks of his return to Victoria, he found himself in the intensive care unit in Victoria suffering from COVID-19 pneumonia. He spent a total of 12 days in the intensive care unit, followed by an additional 4 days on the hospital ward. Gordon's condition was indeed very grave. His blood oxygen levels were quite low, and he came very close to requiring mechanical ventilation and intubation on several times, meaning he was at the point of needing life supports. Gordon was our fifth COVID-19 patient in the ICU. In March, we did not have the resources we do have now. We didn't have the interim high acuity unit. When Gordon entered the ICU, he put our critical care capacity at its limit. And HAU now gives us more space for patients like Gordon at times when critical admissions peak. With the new permanent high acuity unit, we'll have a safe place where patients can be monitored and receive intensive nursing care. There is a higher ratio of nurses to patients in the HAU, and it allows us to have more physician staff in hospital. It's taken a lot of pressure off our ICU teams, and that has lessened the domino effect we often see when we're trying to find places for patients like Gordon who need critical care. I'm extremely happy to report that Gordon is feeling back to 100% and is playing his daily game of tennis. I know you can read more about Gordon's story on the Victoria Hospitals Foundation's website. The permanent ICU will indeed help save lives. It'll help us care for patients much like Gordon in the future. Thank you everyone here today for your ongoing support for making the permanent ICU a reality. Cannot thank you enough.
Thank you, Leah and Omar. We're so grateful for the Island Health team and the work you do to keep our community healthy and safe. My name is Steve McCarroll, and I'm the past chair of the board for Victoria Hospitals Foundation, and had the pleasure of getting to know Seaspan this year, in past year. On behalf of the board of directors, I'd like to give my sincere and heartfelt thanks to Seaspan and the Dennis and Phyllis Washington Foundation. Through your support of our It's Critical campaign, you are truly transforming critical care on Vancouver Island. We all know that 8 months ago, everything changed for our hospitals and care teams. The community rallied together to support our front lines, and Seaspan and the Dennis and Phyllis Washington Foundation have now stepped up with an incredible $2.65 million donation to VHF, the largest publicized gift that we are aware of in BC in response to COVID-19. This means we're now more than halfway to our It's Critical campaign goal. And with this gift, you will make the island's first HAU a reality sooner than expected. With this gift, you are making sure our hospitals are ready for tomorrow's challenges. You are demonstrating what it means to be a community leader and inspiring other leaders and community members to support this campaign. You're investing to improve the quality of life for the most vulnerable members of our community, not just today, but for future generations of Islanders. So I thank you for your vision and your generosity on behalf of Victoria Hospitals Foundation, but also the many patients you're supporting. Thank you to Leah Hollins and Dr. Ahmad for telling us what HAU means for our community, our care teams, and our patients. We're so proud to partner with Island Health to help address the greatest needs in our hospitals. Thank you to all of our viewers and guests today for being here and celebrating this incredible announcement with us virtually. We're going to take questions from the media in attendance now. You are welcome to listen in if you wish. I now pass the virtual microphone over to our media liaison. Thank you.
Thank you, Steve. As discussed with media prior to the event, if you could just in the media Q&A, which you will find at the bottom of your Zoom screen, type your name, your outlet, and who your question is for, and then we will take the questions in order that they are received. First up, I do have a question for Avery Broman from Tim Ford of Victoria Buzz. So we'll transfer the mic over to you, Avery.
And I'm unmuting.
And we will unmute you, Tim.
Hello, can you hear me okay now?
I can. Thank you. Thank you for being here with us today.
And thanks for hosting this. So good morning. I just wanted to ask about what this donation means in terms of like progress towards the ultimate goal of constructing the HAU, just for clarity's sake here. So I understand that the campaign was seeking to raise $7 million. The contribution that you received today from Seaspan and the Washington Foundation is 2.65. So can you kind of give us a status update on where things are at and where sort of like a timeline that you're hoping towards eventually constructing the unit?
Yeah, very, very happy to answer that. As I mentioned before, 8 months ago, everything changed for us and our community rallied together. 2,300 donors came together to raise to date $1.9 million. This gift is truly advancing us and propelling this campaign forward. And we have $2.4 million left to raise now. So to say that it's advancing our campaign might just be an understatement. We needed a community hero. We asked Seaspan Victoria Shipyards if they would be that hero for us, and they would. Right now we're very mindful of how many businesses and community members can donate. It's a really hard time, and the generosity that Seaspan has given us allows us to propel that movement forward. With a permanent high acuity build, it will take time. We have to make sure that it's in the right place for our hospitals. So my answer to you is the minute we can finish this campaign, the quicker it is to have a purpose-built high acuity unit in our hospitals. So I would love to see this campaign close within the next few months, but we won't stop our work until it's over.
Great, thank you, Avery. And any other media outlets, again, just hit the Q&A button at the bottom, type your name, your outlet, and who your question is for, and we will transfer the mic over to them. I'll give everyone a moment to put in a question. And if we don't receive any other questions in the next minute or so, we will potentially call it. If you are having any trouble accessing the questions, you may also use the chat. Just let us know. All right, great. We have Tim again with a question for Dr. Ahmad. So we will switch over the camera. There we go. And Tim, we will unmute you. One moment.
Thank you. I didn't see any other questions popping up, so I felt I was on safe ground to just go ahead again. Good morning, Dr. Ahmad. I just wanted to ask about, with regards to the unit itself, can you talk a little bit about, I've read a little bit about the beds and everything that are going to be proposed for the facility, but just in terms of like the types of patients, you touched on it a little bit, the types of patients that would be admitted to this and the type of equipment that you would want to acquire for the unit. Can you go into those details?
Certainly, yeah. Good morning, Tim. Nice to hear from you. Yeah, like I'd mentioned, there are going to be patients that are critically unwell, but not necessarily patients that need to be on life support, that won't be on mechanical ventilators, for example. But anything short of that, potential admission for our high acuity unit. So certainly patients who have had, fairly advanced surgical procedures or are needing a little bit of extra support for their blood pressures. Their blood pressures are a bit soft. They're in a condition called shock. So we can give them some medications through a specialized IV that allows us to pump up their blood pressure. They might not need mechanical ventilation and intubation for their respiratory status, but they certainly may need it down the line. And so rather than having them on a ward, we keep them in the HAU, where we keep a very, very close eye on them. And the idea, and we've certainly seen this, is that sometimes by having this extra vigilance and extra care for these patients, they can avoid actually going on to mechanical ventilation because of the heightened observation by our nursing staff, by our respiratory therapists. And sometimes we see patients where they're not looking too bad, but there may be a subtle hint that things might start to deteriorate, such as a slightly rapid respiratory rate. And so when we're not quite sure, bringing up to the HAU would be another a great avenue for these patients, where we can watch them very, very closely, so that if they do start to deteriorate, we can intervene immediately, as opposed to sometimes these patients may be delayed if they're in other areas. And ultimately, patients that have suffered from trauma as well, cancer patients, patients that are on dialysis that might need a bit of extra blood pressure support, and the list goes on. I can certainly continue, but hopefully that answers your question, Tim, but I'm happy to elaborate if you would like.
All right. Tim, I guess that means that we're good with your question. Again, any other media, if you have a question, just hit the Q&A button at the bottom, type your name, outlet, and who your question is for. And you may also reach out to the VHF communications team. You'll receive the press release momentarily to book any follow-up interviews, but now's your chance to get our guests if you do have a question. So we'll hold it for one more minute and see if we have any others come through. All right, it looks like we don't have any other questions that have come through. So thank you everyone for attending today and joining our live stream. We really appreciate it. And thank you to all of our speakers and guests. We are so thankful for that donation from Seaspan of $2.65 million to the Victoria Hospitals Foundation's It's Critical campaign. Thank you so much.
Thank you.